I'm Dr. Umesh, a consultant neurologist in Care Banjara, Hyderabad. Today we are learning and understanding about a headache, and headache is a quite common symptom. Headache comes with primarily because of the brain, and then its coverings, and then at the same time headache can be due to a systemic disease. So it's very important, very common symptom. Let us understand about the headache. And today we have Dr. Suman with us, who is a neurologist and did his specialization in headache. They're called a subspecialist. Warm welcome, Dr. Suman.
Hello.
We commonly see these patients of a headache in our clinic. Some of them, they come primarily for a headache as such. Why this headache is a symptom? What should be the cause of this headache, the mechanism of a headache?
We can categorize headaches into secondary headache disorders and primary headache disorders. The secondary headache disorders is secondary to underlying pathology, like if there is any infection, inflammatory disorders, if there is any cancer, any soft tissue structures like joints, if there is any problem with those structures, if there is any vascular pathology also, like in case of stroke, or if there is any bleed into the brain.
So you mean this headache can come from a younger age to a older age? How is the distribution like if you see in your practice?
In case of younger age group, these primary headache disorders are common, and these primary headache disorders is because of imbalance in the neurotransmitters, which result in sensitization of the pain sensitive structures around the brain. And in case of elderly age group, these secondary headache disorders are more common, while among primary headache disorders, tension type headache can be common in elderly age group.
Oh, do you think this primary headaches are like we should not be worried about primary headaches?
Usually secondary headache disorders can be life-threatening. Primary headache disorders might not be life-threatening, but they can result in significant morbidity. That is, they affect this quality of life. And as these headaches, they are in middle age group, so they are mainly in this working age group. So the working class gets affected, so it can affect the economy of our country also.
So what we understand is a headache can come in a younger age as well as a older age people now. Now let us know about the causes of a headache in especially younger group. Commonly, if we see these headaches in our clinical practice, I being as a neurologist, I also see a headache. But when is this headache is alarming? When this headache is not alarming, which can be taken very lightly in our clinical practice?
When a patient comes to us with complaints of headache, so we need to look into the history and then followed by the examination. That is what we do. And if the examination is normal, and in the history if there are no alarming red flags like something like fever, loss of consciousness, seizures, or otherwise if they are not immunocompromised group, or in case of special population like pregnancy and all, we might give a trial of analgesics and see. But based on the history and the examination, if the neurologist, if we find any red flags, we might need to evaluate the patient further.
And especially, we come across patients, especially those who are in their schooling schooling and stress, schooling and migraine. And how do we understand about this?
In school age group, when these kids and all, they present with headache, we need to first rule out these refractive errors. And if the refractive errors are ruled out, sometimes these kids are sent to us by an ophthalmologist after ruling out the refractive error. Then in those cases, among adolescents, the primary headache disorder like migraine, it starts to peak. So we need to look at the associated features. And again, like I mentioned, history and examination, we need to categorize whether it is primary headache disorder or whether there are any features of secondary headache disorders.
So I think what we understand by Dr. Suman is it's very important to see a headache specialist to know about is it a benign or is it an alarming headache. I think patient needs to be examined by a specialist who decides about what investigations to be done in particular these patients. What investigations are available for this understanding about different types of headaches?
Mainly when these patients they present with headache, so first it is history, because in some of these headaches all the investigations might be normal, especially in primary headache disorders, but it doesn't mean that they are not having a disorder. So based on the history, we should have a working diagnosis, likely what we are dealing with, and examination adds to that. and based on the history and examination, we will be able to conclude whether we need to do MRI of the brain, or we need to look at the vessel structures like MR angiogram or MR venogram, and then further followed by that, if we need to do any CSF analysis. And sometimes when we suspect if there is increased pressure in the brain, we need to look at the fundus, what we call as the eye nerve, to understand the pressure of the brain. And in elderly age group for cervicogenic headaches and all, we might need to do MRI cervical spine and all.
Now that means, okay, now every patient of a headache, we need not have to go through investigations. Probably, what are those cases? Okay, patient should know that he should be prepared to go ahead for investigations. Like the other day, you were saying that patients with a neurological deficit, like for example, patient who got weakness on one side, patient who got a fits now of a headache patient have got a fits, headache patient who got a weakness, and do we need to go these investigations as a mandatory, or shall we have to wait and see for the deficits or whatever problems we have to recover on their own?
As I mentioned, all new onset headaches, especially new onset headache beyond 50 years of age group, and in case of immunocompromised population, special population like pregnancy, and if there are any associated features like fever, if our examination is abnormal, and in the history if there is any loss of consciousness or otherwise seizures, these cases definitely they should go ahead with the imaging. While if a patient presents with a history of headache, for example like 10 years, and then the history fits into like migraine and all, it is okay even if we don't do the scan, because we expect it to be normal.
So in my clinical practice last about 3 decades now, people have an understanding. If it is a migraine, it doesn't go. If it is a tension headache, how the tension can go. Now, what is, what you want to convey to our public, saying that, okay, migraine is untreatable, or is it controllable, or can we completely eliminate a migraine?
Migraine, it starts usually by adolescent age group, and then it peaks around 30 to 40 years of age group, and then gradually comes down. In some patients in elderly age group also, they might have these migraine attacks. Now, as of now, we have modalities to control the pain, to reduce the pain, but we don't have modalities for complete cure. So the treatment depends upon how frequently they are having the attacks.
What are those triggers actually, the triggers for a migraine? Now, for example, going into the sun and sleep deprivation. Apart from that, how much is the emotional disturbances will contribute for a headache?
There are a lot of triggers in migraine, and the triggers might vary from person to person, and stress is also considered as one of the trigger for migraine attacks. And research has shown that with lifestyle modification, if we are able to address the stress component with the help of the psychologist, the frequency of attacks might come down.
Okay. And apart from these drugs which are available, and then I heard that there are many modalities of other treatment also. So now how far we have traveled in treating this migraine?
Lot of research is happening for many years in case of migraine, because when it comes to treatment in case of migraine, we have abortive therapy. Abortive therapy is a therapy which will help for the immediate pain relief.
And so we can abort it. We can abort that headache.
With those medications, we will be able to abort the attack. But then the headache might come back in the same day or otherwise at later part of time. So based on the frequency, how many times these people have attacks in a month. If these patients are having once or twice in a month, we will be able to manage with abortive therapy. But if they're having more frequently, like 4 or 5 attacks in a month, now along with abortive therapy, they will require preventive therapy. Now in this preventive therapy, previously we used to have medications, and then for chronic migraine and all, we used to have Botox therapy, which is time tested and safe. Lot of research is happening in case of migraine regarding this preventive therapy. Now we have new molecules, monoclonal antibodies, and then we have devices. These are called as neuromodulation devices, which are useful in abortive therapy as well as for preventive therapy.
Now, apart from these all modulations and then pharmacotherapy, now what's the role of this counseling and the emotional support, and then psychologist role in this migraine and then different types of primary headaches?
So the management of migraine is multimodal approach. So when it comes to the treatment, so in the history, we need to look into what are all the triggers, Are there any stressors, work-related stressors, financial-related stressors? Is there any sleep deprivation? And we need to look into the weight aspect of the patient. And lifestyle modification has significant role in reducing the frequency of attacks. So it's not just the neurologist or it's not just the headache specialist who will treat the migraine. So there is the role of the psychologist, and then there is the role of the lifestyle modification which has to be followed by the patient regarding attempt to reduce weight, and then daily exercise and adequate sleep for about 7 to 8 hours daily, and yoga and meditation. All these, as per literature, have shown beneficial effect in reducing the frequency of attacks along with the medication.
I think you all agree with me now, and then we have learned and understood the most part of a headache here. And the headache is not simple and not to be ignored. It has to be attended on time. And to see a neurologist, especially a headache specialist, I think is very important. Subtle features can be missed by many. I think if we see an expert, there is less chances of missing it. We treat a disease specifically with a very good drugs available. There's a lot of research is being done, and I hope you use headache specialist services for this. Thank you.
Thank you.